We are Majestic Care Providers, NG. To the Minister of Health, Federal Republic of Nigeria, to the various state governments, the governors of various states, and to individual investors. My name is NGOZI RBK OKAFOR. I'm here to crowdsource the amount of $10 million in return for 15% equity for our company that is going to be based right here in Nigeria. My presentation is rather lengthy, so I don't want to go into the effects, what we have done, but suffice it to say, I am a professional healthcare provider for the last 25 years, and I have been running 2 healthcare industries in Houston, Texas, and we are now poised to bring one of those companies as a startup right here in the Nigerian market. The problem as we see it is,
can you help us change this slide, please?
Next slide, please. Next slide,
IT. Change it for her.
Why is this not working anyway?
Do it manually from here.
Okay. The problem is ineffective delivery of healthcare services in Nigeria. The solution is we will bring the care to you. You don't have to come to the care. I have, during our survey when we were doing the preliminary for the company setup, I came across a young man who is actually employed by the federal government, and he was opportune to have healthcare insurance through his employer. And I asked him, how often do you access the care? But he hardly ever accesses the care. The only time he goes to the hospital, very reluctantly, is when a member of his family is acutely ill. And they know what you look like. They know how you are. They know the condition of your health. So that when you are acutely ill, not if, we all get sick. Eventually, you will get sick. You will need to access the healthcare system. So you don't want that first time you're accessing the system to be your brand new. And you get to a federal medical system, and they don't even touch you. A doctor doesn't touch you for 20 hours. It's frustrating, it's dangerous, and it doesn't have to be that way. We can change that. We can facilitate the idea that when you walk into a federal medical center, you're acutely ill. All they need to do is identify you as a patient with your name. And on the computer, they will know who you are, where you live, what your weight is, what your blood pressure is, the last time the doctor saw you, and they will know the deviation, and they will know how to treat you promptly and quickly. The diagnosis comes faster, the treatment plans come more efficiently, and you are taken care of better. Your health, if you don't have your health, you don't have anything. So we have to make our health, our national health, a priority. Right now, it's not, based on the resources we allocate to it.
NGOZI OKAFOR, thank you very much for your brief and smart presentation.